The Bernie Sanders-Joe Biden joint task forces have released their policy roadmaps. So these were the joint task forces put together by the Bernie and Biden teams to develop a plan, an idea of what Joe Biden would be fighting for in this election and also going into his presidency, assuming he wins. Now, I'm going to go over the healthcare aspect of this because there are other ones that deal with climate and other issues. But I'll go over the healthcare one based on what Abdul El-Sayed, who was on the Joint Task Force for Healthcare, based on what he tweeted about. But first, let me just give you the quick overview here from NBC. Democratic task forces send Biden a progressive policy roadmap. The recommendations reflect areas of consensus reached after weeks of deliberations between allies of the presumptive Democratic nominee and Bernie Sanders. And here you go. So they're based in climate change, criminal justice reform, the economy, education, healthcare, and immigration. So I'll be talking about healthcare. I'll also link to, if you want to read this, the giant PDF that goes through all of it. So all the details are in here. But before I get to healthcare, we have to remind ourselves, Joe Biden did not win the nomination because of policy. People did not vote for Joe Biden because they looked at Bernie Sanders and his policy platform and Joe Biden and his policy platform and thought, you know what, I like Joe Biden's policy platform. Ask anybody who voted for Joe Biden. Ask them to name just three, of Joe Biden's policies. They're not going to name anything because Joe Biden did not win because of that. Joe Biden won because of nostalgia, because of his attachment to Barack Obama, and because of this desire for a return to normal. And to them, many of those voters, Joe Biden represented that return to normal. Now, of course, I could spend all day criticizing, what that could lead to, the issues with that. I won't, but Joe Biden, the point here being, Joe Biden did not win the nomination because of his policy platform. And looking at healthcare, it's obvious as to why. As we see poll after poll after poll, as coronavirus surges, Medicare for All support hits 9-month high. So it already had a majority of support. More people now support Medicare for All. You look at Kaiser Family Foundation, another poll here showing support's going up for Medicare for All. As of May, 56% support. Another poll here. Let me go small for this one so I can stretch this out. So support for, it's not really helping here. There we go. So this is from The Hill, Harris X. Support for Medicare for All remains consistent. Would you support or oppose providing Medicare for All to every American? So back in October 2018, that's the light blue, 70% support. And in April, 69% support. So barely any movement. It's within the margin of error. Basically, a majority of people still support Medicare for All. Yet, Joe Biden not supporting it. And this is, by the way, this is overall voters, not just Democratic voters. If you ask just Democratic voters, it's 85, 90+% of people support Medicare for All. But all voters, 70% support or 69% support, regardless of what it is, majority support. Yet that is not what Joe Biden's fighting for. So understand, Joe Biden is not, his policy is not dictated. Let me go a little larger here. His policy is not, his platform is not dictated by what people actually want. It's dictated by who supports him. Big pharma, insurance companies, the healthcare industry in general, other corporations when it comes to other areas of his platform. So with their influence and their money still embedded in the Democratic Party, there's only so far that Joe Biden's going to go. So, and also, it's worth mentioning as well, think of all the things that the government does that most people don't agree with. Military spending, look at the tax breaks for the wealthy, tax breaks for massive corporations. Look at all the support during the pandemic that corporations have gotten from the government. People don't support that, but they do it anyways. So this polling aside, we should be doing, or the government should be doing what they need to do to actually help people, to support people. So Medicare for All, regardless of what the support is, a single payer Medicare for All system, when you look around the world, you see how effective it is compared to the American system. Regardless of public polling, the American government should be helping Americans with a single payer system. But even with that, you also have, on top of that, the support of a majority of people. Now, let me get to the breakdown here. This is about 19 tweets. Just letting you know. So if you don't like it when I read things for a long time, this may bother you, but you could speed up the time here on YouTube, so I'll get through it quicker. But I do want to get all the details here because it's important to discuss what is being proposed here in Biden's, or at least in this joint task force that will go to Joe Biden, and I guess he gives the green light or not as to whether he's going to back all of it. But Abdul El-Sayed here, tweeting out, "I support Medicare for All. It's why I supported Bernie Sanders. It's why I co-authored Medicare for All, A Citizen's Guide with Mika Johnson. And it's also why I agreed when Bernie asked me to join the Unity Task Force on Healthcare, a thread." So he starts here, Joe Biden isn't Bernie, obviously. He does not support Medicare for All. We deeply disagree on this. But he does support universal coverage, expanding public coverage, reining in pharma, and health equity, things we do agree on. Now, I will, I'm not going to criticize every tweet here, but I don't think you can truly support universal coverage if you don't support Medicare for All. But going on, our task force recommendations build upon these aims. Our task force worked hard, and I'm grateful to the team and co-chairs, Pramila Jayapal and Vivek Murthy. We didn't agree on everything, but we came to recommendations that will yield one of the most progressive Dem campaign platforms in history, though we have further yet to go. Below is a rundown of some of the task force's key recommendations. In view of COVID, we recommend that all testing, treatment, and vaccines for coronavirus or any health crisis be free, regardless of your immigration status or ability to pay. So already this is awesome. Keeping in mind, Biden is not going to support Medicare for All. You have to think of what is the best possible scenario in lieu of Medicare for All. Already this is a good start. So ensuring that all healthcare in any crisis is free. Now, going on here, we rein in pharma's greed by allowing Medicare to finally negotiate prescription drugs for all Americans, using prescription drug prices in other high-income countries to make sure Americans don't pay more, ending Big Pharma's never-ending monopoly extensions. So these are also good provisions here. We build on and We build on and expand Biden's public option to make it truly public, Medicare administered, more generous, cutting out-of-pocket in half, automatic for low-income Americans, inclusive of zero deductible option. So this is something that I will need to sit a little more with and do and read people's analysis in terms of healthcare experts and their thoughts on this. But there's always been a worry that a public option could lead to a system where you have the private insurance companies essentially draining the public system of resources by offsetting all the really sick people onto the public system, and then they can go and say, "Hey, look at how poorly the public system is performing here. So must go back to the old way where it's only private insurance." So there's always been that worry that in a public option scenario, the private industry could work to ensure that the public option is not successful. Now, some of these points here may help to prevent that from happening. Again, I'm going to have to read more analysis on this, but it sounds better. At least, Abdul El-Sayed, being a doctor and a healthcare professional, he appears to be making these points because he feels this is a better way of going about a public option than it's generally been viewed. So he says here it is now more generous than Medicare. Going on, we lower the Medicare age to 60 and improve support for holes in the program like vision, hearing, and dental coverage and long-term services and supports. We also expand Medicaid access to people in states where GOP never expanded Medicaid. Also, very important here. When I ran for governor in Michigan, I ran on a state-based single-payer system that should have been subsidized by the federal government through the ACA's 1332 waiver program. Our task force reinforced support for those subsidies for state-based universal insurance programs. To uproot health disparities that take Black and brown lives far too early, we call for an executive order for a White House-led effort to assess our government's impact on structural and institutional inequity, and seek to solve them. It comes with real teeth and resources. We recommend fully funding the Indian health services and investing in resources that provide critical infrastructure to support health in Indian country, and eliminating arbitrary barriers like public charge and 5-year waiting period that keep immigrants from health care. So again, these are These are important, very specific steps that, again, in lieu of a Medicare for all system, that you wouldn't have to worry about any of these holes. But because they exist, it's important to have to make these points and sort of have this piecemeal approach where you ensure you're recovering people that may otherwise be forgotten. He says here, we recommend repeal of the Hyde Amendment and codifying Roe as the law of land to protect a woman's right to choose, and eliminating discrimination against LGBTQIA plus Americans in healthcare and federal support for healthcare services. To take on COVID-19, we recommend a full reinvestment in federal, state, and local public health, including an additional $10 billion a year to support 100,000 more public health workers. We also recommend double funding for federally qualified health centers. We recommend expanding the National Health Service Corps to increase the diversity of our health workforce, and doubling the community health worker force and invest in 600,000 new healthcare providers for long-term services and support, all earning $15 an hour plus benefits. Again, like, one thing that really stands out to me here is you wouldn't need all of these specifics. Like, you wouldn't need all of these little pieces if you had a Medicare for all system that just covered everyone. Everybody paying into it, a single payer system like we have in Canada. Everyone pays into it, and you have healthcare free at the point of use. Go into any walk-in clinic. It's not tied to your employer. You never have to worry about losing your healthcare because you lost your job. You can leave your job if you don't like your jobs. Go to a new job somewhere else, or work somewhere else, or start a business, or go back to school, and you're always going to have healthcare because it operates independently from your employer. So, like, a lot of these holes, again, it's a lot of minutia here, unfortunately, but it's stuff that has to be brought up and discussed, and there has to be solutions because there's no healthcare, no Medicare for all that would cover all of this. To expand mental health services and substance use treatment, we eliminate the barriers to providing these services in outpatient clinics and FQHCs and expand counseling support in schools. Taken together, this is the most progressive democratic healthcare platform in American history, yet it's still far from what I believe ought to be our goal. Hashtag Medicare for all. So where does that leave us as progressives? Honestly, I think the choice is clear. We can choose to fight like hell through November, and then for the next 4 years to make sure we turn this platform and more into law under a Biden administration, expanding public coverage and building towards Medicare for all, which I believe will be a U.S. health policy someday soon. Or we can spend the next 4 years fighting against the ACA repeal, fighting against federal neglect of the COVID-19 pandemic, fighting against discriminatory health policy, such as the public charge rule or restrictions on birth control, abortion, and PrEP coverage. To me, the question of policy always comes back to the folks I got to serve as health director in Detroit. They go without healthcare coverage, die at 2.5 to 3 times the rate of preventable diseases like COVID-19, breathe polluted air, and drink poisoned water. I support Medicare for all because I believe it would benefit them the most, which is the same reason I support Joe Biden in this next election. And I will keep working toward a world where Medicare for all is the law of the land. Right now, they're the same thing. So, obviously, this does not go far enough. As I've said a million times, Medicare for all is the solution. But Abdul El-Sayed is correct to point out that you would be fighting these fights that people have already won if you had former years of Trump. This is the issue, one of the main issues with Donald Trump. It's not even just put a pause on progress. It has reversed progress, causing us to have to refight fights that you already won. So you don't want 4 more years of that, because who knows what kind of hole it's going to put Americans in. This is why, yes, of course, this is not enough. But the way to enact Medicare for all is to not go back even further. It's to progress. It's to continue the fight. It's to have people stand up and protest and fight for universal coverage, fight for Medicare for all. So he makes, I think, the correct point here. And I mean, this also is not related here, but I got to mention it since I'm mentioning Donald Trump and Joe Biden. Republicans are always going to be for restricting voting rights. They're always going to be for voter suppression because they win when turnout is low. Democrats win when turnout is high. So based on that alone, if you care about democracy, if you care about people's ability to vote, if somebody wants to vote, they should be able to vote. If you think that's, yes, if you agree with that, then, I mean, I think the choice here is obvious. Because you have one party that is restricting voting rights, that will continue to lead to a situation where the vote or the result of the vote is not truly representing the will of the people because of voter suppression. So, apart from healthcare, I think that needs to be focused on as well. But Abdul El-Sayed, I trust his thoughts on this. He's been a real fighter for Medicare for all. He one of the big important surrogates for Bernie Sanders. So again, I will continue reading into the analysis, especially when it comes to public option and the analysis on what these steps will do in terms of ensuring a public option won't just simply be a way for private insurance companies to drain that system and give an argument for why they should continue or go back to a private system only. So I will continue to read more about this and ensure that those steps that are being taken in this task force will help to prevent that from happening. But this is as good as you're going to get without Medicare for all. So while of course it's not enough, it clearly is a move in the right direction.